This morning on BRN, tips for successful, compassionate advanced planning talks. Joining me now is Terry Wihlen of Optum Home and Community Care. Terry, great to see you. Thanks for joining us on the program this morning.
Thank you, Jeff. Glad to be here.
Yeah, I'm glad that we can tap into your experiences, and we'll talk a little bit about your background throughout the conversation. But let's start with some basic questions, and that is, what is, in your mind, the definition of advanced care planning? So when you wrote about that for McKnight's, what were you thinking about?
Advanced care planning for me is really aligning values, beliefs to a member's care at their final years of life. I work in nursing homes. That's our business within Optum, the United Healthcare Nursing Home Plan, and we take care of members who've been admitted to long-term care, and on average, they live for about 2.5 years. That's the average. So advanced directives, most people know that's whether or not you want to be resuscitated on a ventilator in a hospital or go to a hospital. Advanced care planning is more about those other items that we need to know about. How do you expect to be treated with the time that you have left? Do you want someone to help feed you? Do you want IV fluids when you're no longer eating or drinking and you have a few weeks left? Those are more detailed than advanced directives. So advanced care planning is something that at Optum, we are very passionate about, because if we can align a member's values and goals to how they want to be cared for, it really provides a path for their comfort and also their dignity. It gives them autonomy.
Not to interrupt you, Terry, but I want to just follow up on that. And death, it's final, and we all are going to experience it. But there's kind of a stigma around it. No one really wants to talk about it. How do you start that conversation? That was a thing that I picked up in your piece. It's important to talk about these things, but because there's a stigma around it, and I don't want to talk about it. How do you start that conversation with a loved one?
So with our complex care clinical model in Optum, we have conversations within the first 30 days that a member joins. And how do we start that conversation is usually face to face. I typically would call a family member when I was practicing and say, hey, I'm going to be seeing your mom. I'll introduce myself. I'm going to be seeing your mom. And then I want you to come in so you get to know me, so I get to know you, and then we can align on the information that I've gathered and what you know, and have some deep conversations about what's next for your mom. They always would want to come in and sit down. It was the best way to start those conversations. Advanced care planning should not be in an urgent situation, because family members or members are stressed at that time.
Yeah.
And a lot of times there hasn't been a lot of conversations besides advanced directives.
And in terms of starting the process, we don't know. Unfortunately, we don't know. We know, you're born, you live, but you don't know when the end is coming. So do you approach that, for example, you approach this in your 20s, your 40s, your 60s, or are just some general rules of thumb as when you should start? I don't want to be a Debbie Downer for a 20-year-old, but anything can happen to somebody. They can get hit by a car. They can have some kind of disease. So when's the best time to start thinking about this stuff and laying out this advanced planning?
So earlier, the better. In the 20s would be great. Unfortunately, when we're in our 20s, we're at our peak as far as feeling alive. And typically, usually in the 30s, we start, and 40s, start experiencing death around us.
Yeah.
And I've experienced that. I'm sure your viewers have experienced that. And you start thinking about what's important. How do I want to be cared for if I have a stroke or I have to go to a nursing home? How do I want to pass if I have a terminal illness? And as soon as you start thinking about that, you should be sharing your thoughts, working with a professional, getting it down in a paper, whether it's advanced directives, living will, assigning a healthcare proxy if you can't make those decisions. But it goes, the the rule is you have to communicate it also. There are many times that I've met with family members and they're struggling because they did not have that conversation with their loved one and they're the healthcare proxy. And in those situations, if it hasn't been discussed, you really have to dive into past experiences for the member, um, who they were before they came to the nursing home, how did they respond to other people passing, how did they respond when their parents passed. And you can dig out through open-ended questions, beliefs, and values just based off of prior experiences.
And is there you mentioned one of the things that Optum does is it can work with clients to do this. Are there other practitioners that you can get assistance from? For example, attorneys, CPAs, financial advisors. Can they act as intermediaries to help somebody with this planning?
I think also you can work with clergy or someone that you align faith with. It's a conversation. When it boils down to with attorneys, you can have power of attorney for someone, but that doesn't really mean that they can make those end of life decisions. A healthcare provider is the one that can really lay out. Um, what's the best option for you as an individual based off of your beliefs. And I would say also, we do have special services available, especially for people who are critically ill. There's hospice and palliative care centers across the country, a lot of experts in our field, geriatricians, really understand the value of advanced care planning.
And if you start in your 20s, what if your values change? I mean, I can look back at my 20s, and one, I had hair, so my physical appearance was very different. But in all seriousness, my values may have changed. My values on religion, my values on how I perceived my future, some of these things. So can you go back once you've documented this and amend that? And is that recommended to revisit over a period of time?
100%. For our organization, Optum in long-term care, we visit it or revisit it every quarter when a person is well, because things change. Family members come in and see their mom who's had a big deterioration, and they may want to switch to more of a comfort care, or they haven't seen their loved one in 6 months and they want more aggressive care. As an individual, and when I was 20, I wanted everything done. I'm in my 50s. You made a joke about your hair. My joke is that I used to be in shape and now I am a shape. So that's just part
We
of
all are
life,
in that
because we
position. Yeah.
all change. We
Yeah.
all change, and I think over time we have different experiences that help shape who we are and what we believe and what we may have, really strong feelings for when we're younger is now something that we can digest and evaluate and learn from.
Yeah. I mean, life is a learned process. I mean, it is. And we evolve, we grow, and certainly perspectives change over time. And I agree with you. I have changed since my early 20s. Terry, we're going to have to leave it there. Great conversation, great piece. Thanks for joining us, and we look forward to having you back on the program again very soon.
Thank you so much, Jeff. I really appreciate it.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, are at our website. And we're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.